You have been told your entire life that sweets are off limits when you have acid reflux, that desserts will only make your heartburn worse, that you must sacrifice every sweet pleasure to manage your symptoms. But what if I told you that is a complete lie? What if 4 specific homemade sweets could actually cure your acid reflux, heal your damaged esophagus, and allow you to enjoy dessert again without pain or fear? I am Dr. Grace Nakamura, a gastroenterologist with over 10 years of clinical experience, specializing in digestive health for women over 60. And today, I am going to expose 2 popular homemade sweets that are destroying your esophagus every time you eat them, causing damage that could lead to cancer, and reveal 4 miraculous homemade sweets that neutralize acid, reduce inflammation, and eliminate reflux symptoms permanently. Before we begin, if this information could transform your relationship with food and end your suffering, leave your like down below. And if you want to receive medical breakthroughs about digestive health every week, subscribe to the channel and turn on notifications. Now let us get to the shocking truth that could change everything. First, you need to understand why women over 60 develop such severe acid reflux that most doctors tell them to avoid all sweets completely, and why this blanket advice is not only wrong, but potentially harmful. In my medical practice, I see heartbroken women every single day who have given up all joy in eating because they were told that enjoying any sweet food would destroy their health. They look at desserts with longing and sadness, believing they can never have sweetness in their lives again. The truth is far more nuanced and hopeful. After menopause, your digestive system undergoes massive changes. Estrogen levels plummet, and this hormonal shift weakens the lower esophageal sphincter, the muscular valve between your stomach and esophagus. This valve is supposed to stay tightly closed except when you swallow. But in postmenopausal women, it relaxes and stays partially open, allowing stomach acid to flow backward into the esophagus. This causes that burning sensation you feel in your chest and throat. Additionally, many women over 60 take medications for arthritis, high blood pressure, osteoporosis, or heart conditions, and some of these medications further relax the esophageal sphincter or irritate the stomach lining. Stress, which is common in this age group due to health concerns, family responsibilities, and financial worries, increases stomach acid production dramatically. When you combine a weak sphincter with excess acid production, you get chronic severe reflux that damages the esophagus day after day. Now, most sweets are indeed terrible for reflux because they contain refined white sugar, which ferments in the stomach, producing gas that increases pressure and forces acid upward. They also contain high amounts of fat from butter, cream, or oil, and fat delays gastric emptying, meaning food sits in your stomach for hours, creating more opportunity for reflux. But certain homemade sweets made with specific ingredients can actually heal your digestive system while satisfying your desire for something sweet. The key is knowing which ingredients heal and which destroy. The 2 homemade sweets that are burning your esophagus like acid and that you must never make or eat again are chocolate brownies and lemon bars. Let me explain exactly why these seemingly innocent treats are catastrophically dangerous for women over 60 with acid reflux. Chocolate brownies are one of the most beloved desserts in the world. Rich, fudgy, indulgent. But for someone with acid reflux, chocolate brownies are absolute poison. Chocolate contains 3 compounds that devastate your esophagus. First, chocolate contains methylxanthines, including caffeine and theobromine. These compounds directly relax the lower esophageal sphincter. Studies have shown that consuming chocolate causes the sphincter to open and stay open for up to 1 hour, allowing acid to flow freely upward during that entire time. Second, chocolate is very high in fat. A typical brownie contains butter, eggs, and sometimes cream or chocolate chips, making it extremely fatty. Fat delays gastric emptying significantly. When you eat a chocolate brownie, It sits in your stomach for 3 to 4 hours, much longer than other foods. During this time, it ferments, produces gas, and creates massive pressure that forces acid into your esophagus. Third, chocolate stimulates acid production. The compounds in chocolate signal your stomach to produce more gastric acid. More acid combined with a relaxed sphincter and delayed emptying creates a perfect storm of reflux. In my clinical practice, I have seen women who ate chocolate brownies, occasionally at family gatherings or celebrations, and they suffered for days afterward. The damage was so severe that some developed esophageal ulcers that bled. They vomited blood and required emergency endoscopy. When I told them they could never eat chocolate again, they were devastated. But their esophagus healed, and they learned to find sweetness in other safer options. Lemon bars are the second homemade sweet that destroys women over 60, and this surprises many people because lemon seems natural and wholesome. But lemon is one of the most acidic foods that exists. Lemon has a pH of 2 to 3, which is extremely acidic, almost as acidic as stomach acid itself. When you eat a lemon bar, you are pouring acid directly onto an already inflamed and damaged esophagus. It is like pouring salt on an open wound. The pain is immediate and intense. Lemon bars also contain large amounts of white sugar, which ferments rapidly in the stomach, producing gas. They contain butter and sometimes cream cheese, adding high fat content that delays digestion. The combination of extreme acidity, sugar fermentation, and high fat content makes lemon bars absolutely disastrous for reflux. I have treated women who ate a single lemon bar at a church potluck or family dinner, and they experienced such severe reflux that night that they could not sleep. They spent the entire night sitting upright, choking on acid, coughing and suffering. Some ended up in the emergency room thinking they were having a heart attack because the chest pain was so severe. When testing revealed it was reflux, not a heart attack, they were relieved but confused about why one small lemon bar caused such extreme symptoms. The answer is the perfect combination of reflux triggers all in one dessert. Any citrus-based dessert including key lime pie, orange creamsicle bars, or grapefruit cake is equally dangerous and must be avoided completely if you have acid reflux. Now let us move to the 4 miraculous homemade sweets that actually cure acid reflux, heal your esophagus, and allow you to enjoy dessert without any pain or damage. The first healing sweet is baked apple with cinnamon and honey. This dessert is not only safe for acid reflux, it is actually medicinal. Apples, when baked, become incredibly soothing and healing for the digestive system. Apples contain pectin, a soluble fiber that coats the stomach and esophagus, creating a protective barrier against acid. Baking the apple makes it soft and easy to digest, requiring minimal stomach acid for digestion. Cinnamon has powerful anti-inflammatory properties that reduce inflammation in the esophagus. It also helps regulate blood sugar, preventing the spikes and crashes that can trigger acid production. Honey, specifically raw honey, has antimicrobial properties that can help eliminate Helicobacter pylori bacteria, which causes chronic gastritis and contributes to reflux in many women. Honey also soothes irritated tissues and promotes healing. To make this healing dessert, core a medium red apple, removing seeds but leaving the bottom intact. Place it in a baking dish. Sprinkle 1 teaspoon of Ceylon cinnamon inside the cavity. Drizzle 1 teaspoon of raw honey over the top. Add a 1/4 cup of water to the baking dish. Bake at 350 degrees for 30 to 40 minutes until the apple is soft and tender. Let it cool slightly and eat it warm. This dessert is so gentle and healing that you can eat it even during an acute reflux flare when everything else hurts. In my practice, I recommend this dessert 3 to 4 times per week after dinner. Patients report that it satisfies their sweet craving while actually reducing their nighttime reflux. Many say they sleep better on nights when they eat baked apple. The second healing sweet is chia seed pudding made with almond milk, vanilla, and banana. Chia seed pudding has become popular in recent years, and it is absolutely perfect for women with acid reflux. Chia seeds are alkaline, meaning they help neutralize stomach acid rather than increasing it. Chia seeds absorb liquid and form a gel that coats the digestive tract, providing protection against acid. They are rich in omega-3 fatty acids, which are powerful anti-inflammatory compounds that heal damaged esophageal tissue. Chia seeds are also high in fiber, which improves digestion and prevents constipation. Constipation increases abdominal pressure, which worsens reflux, so keeping bowel movements regular is critical. Almond milk is alkaline and gentle on the stomach. Banana provides additional alkalinity and contains compounds that strengthen the esophageal sphincter. To make this healing pudding, combine 3 tablespoons of chia seeds with 1 cup of unsweetened almond milk in a jar. Add half a teaspoon of pure vanilla extract and half a mashed ripe banana. Stir well. Refrigerate for at least 4 hours or overnight. The chia seeds will absorb the liquid and create a thick pudding consistency. You can eat this cold or at room temperature. This pudding is perfect as a mid-afternoon snack or as dessert after lunch. It keeps you full for hours, preventing overeating, which is a major reflux trigger. It also provides sustained energy without blood sugar spikes. Some of my patients make a big batch on Sunday and portion it into small containers for the entire week. They tell me it has become their favorite treat, and they no longer miss traditional high-sugar desserts. The third healing sweet is rice pudding made with white rice, oat milk, and cardamom. Rice pudding is an ancient comfort food that has been eaten for thousands of years across many cultures, and it is remarkably healing for acid reflux. White rice is one of the most gentle and soothing foods for an irritated digestive system. It has a nearly neutral pH and is very easy to digest. White rice coats the stomach lining, providing protection against acid. Oat milk is alkaline and contains beta-glucans, a type of soluble fiber that forms a protective gel in the digestive tract. Cardamom is a spice with powerful digestive benefits. It reduces inflammation, prevents gas formation, and aids in moving food through the digestive system efficiently. To make this healing rice pudding, cook half a cup of white rice in 2 cups of unsweetened oat milk over low heat for 30 to 40 minutes, stirring occasionally until the rice is very soft and the mixture is creamy. Add 1/4 teaspoon of ground cardamom and 2 teaspoons of raw honey. Stir well and let it cool slightly. Eat it warm, not hot, because extreme temperatures can irritate the esophagus. This pudding is incredibly soothing and satisfying. It feels like a warm hug for your stomach. I recommend eating rice pudding as an evening dessert, especially on days when you have experienced reflux symptoms. It calms everything down and helps you sleep peacefully. Many of my patients who suffer from nighttime reflux find that eating a small bowl of rice pudding 1 hour before bed eliminates their symptoms completely. They wake up refreshed instead of choking on acid. The fourth healing sweet is baked sweet potato with coconut and a touch of maple syrup. This may not sound like a traditional dessert, but when prepared correctly, it is absolutely delicious and incredibly healing. Sweet potato is one of the most powerful healing foods for the digestive system. It has an alkaline pH that helps neutralize stomach acid. Sweet potato is rich in beta-carotene, which the body converts to vitamin A, and vitamin A is essential for maintaining and repairing the mucous membranes of the stomach and esophagus. Without adequate vitamin A, your digestive lining cannot heal properly. Sweet potato contains complex carbohydrates that digest slowly, providing steady energy without triggering acid production. The soft, creamy texture of baked sweet potato is extremely gentle on an inflamed esophagus. Coconut contains medium-chain triglycerides, a type of fat that is easier to digest than other fats and has anti-inflammatory properties. Coconut also has antimicrobial effects that can help balance gut bacteria. A small amount of pure maple syrup provides sweetness, without the negative effects of refined sugar. Maple syrup contains minerals and antioxidants, and when used in small quantities it does not cause the fermentation problems that white sugar causes. To make this healing dessert, bake a medium sweet potato at 400 degrees for 45 to 60 minutes until very soft. Cut it open and mash the flesh lightly. Top with 1 tablespoon of unsweetened shredded coconut and 1 teaspoon of pure maple syrup. Eat it warm. This dessert is satisfying, nutritious, and healing. You can eat it 3 to 4 times per week. Some of my patients eat this as their regular dinner side dish, and they do not even think of it as dessert. But it satisfies their sweet tooth while healing their reflux. Now you need to know exactly how to incorporate these 4 healing sweets into your weekly routine for maximum benefit and complete healing. Structure and timing are critical. Monday evening after dinner, have a baked apple with cinnamon and honey. Tuesday afternoon as a snack, have chia seed pudding. Wednesday evening, have rice pudding 1 hour before bed. Thursday afternoon, have another serving of chia seed pudding. Friday evening, have baked sweet potato dessert. Saturday evening, have another baked apple. Sunday afternoon, have rice pudding. This schedule ensures you are getting healing sweets regularly without overdoing any single one. Variety is important because each sweet provides different healing compounds. Never eat any sweet immediately after a large meal. Wait at least 1 hour after eating your main meal before having dessert. This gives your stomach time to begin digesting the main meal and reduces the likelihood of reflux. Always eat sweets slowly, taking small bites and chewing thoroughly. Rushing through dessert increases the risk of reflux. Drink only small sips of room temperature water with your sweet. Large amounts of liquid dilute digestive enzymes and can trigger reflux. After eating your sweet, sit upright for at least 2 hours before lying down. Never eat dessert, and immediately go to bed. In addition to these healing sweets, you must eliminate all refined sugar, chocolate, citrus, mint, and high-fat desserts from your diet permanently. These foods will continue to damage your esophagus no matter how many healing foods you eat. You must also manage stress, sleep with your head elevated, wear loose clothing, and avoid trigger foods like coffee, alcohol, tomatoes, and fried foods. I need to ask you a critical question that could save your life. Which of these 2 dangerous homemade sweets have you been making and eating, unknowingly burning holes in your esophagus and pushing yourself toward cancer? Was it chocolate brownies that you thought you could enjoy occasionally? Or lemon bars that seemed so innocent and homemade? As a gastroenterologist who has seen the devastating progression from chronic reflux to Barrett esophagus to esophageal cancer, I am begging you to take this seriously. Write in the comments, "I was eating," and tell me which sweet has been destroying you. Your honesty could prevent another woman from making the same deadly mistake. It is absolutely essential that you understand critical medical information before making changes. If you are currently taking proton pump inhibitors like omeprazole or pantoprazole, do not stop them without medical supervision. These healing sweets support medication, they do not replace it initially. Work with your doctor to potentially reduce medication as your symptoms improve. If you have been diagnosed with Barrett esophagus, you need regular endoscopic monitoring every 6 to 12 months. These sweets can help prevent progression, but cannot reverse existing changes. If you experience difficulty swallowing, unintentional weight loss, vomiting blood, black stools, or severe chest pain, seek emergency care immediately. If you have diabetes, monitor blood sugar carefully with these sweets, especially the ones with honey or maple syrup. If you have kidney disease, discuss with your doctor before increasing certain foods. If you are allergic to any ingredient, substitute appropriately. Quality matters enormously. Use organic ingredients when possible to avoid pesticides that irritate the digestive system. As a gastroenterologist dedicated to helping women over 60 eliminate acid reflux, and prevent esophageal cancer through natural evidence-based solutions. I created this channel to provide life-changing medical information you can trust. Every week, I share scientifically validated protocols, treatment strategies, and natural remedies that work in real clinical practice with real patients. To receive this critical information about digestive health, acid reflux, gastritis, and all gastrointestinal conditions, subscribe to this channel and turn on notifications. Your health is too precious to leave to chance. Chronic acid reflux destroys your esophagus and leads to cancer. But with the right knowledge and action, you can heal completely and enjoy food again. Together we will conquer your reflux, heal your esophagus, and restore your joy in eating. See you in the next video where I reveal the 3 beverages that stop reflux instantly. Take excellent care of yourself and remember that healing is always possible with accurate information and consistent action.